Hello guys, this is Brian here with a video called Obamacare Nightmare for 2016. What's fixing to happen? Today is November the 6th, 2015. It has been a stressful 2 weeks at work, really bad. One of my coworkers died, and a lot of things that's been going on at work that shouldn't be going on, and I'll do another video about that, but this is going to be about Obamacare Nightmare. What has happened here in Texas? I'm affected by this, by the way. Let's see if there's a piece of letter here. Oh, yep, this is the letter. I'm make sure I don't show you my private information. And even though you may be affected by this as well, even though uh, you're not covered by Blue Cross Blue Shield like I am, but this is fixing to happen to other insurance carriers as well. What has happened? Blue Cross Blue Shield has announced that they are canceling all individual PPO policies effective January the 1st and transferring everybody to HMO. Basically, they're getting rid of the PPO. That when I heard that, I heard it on the TV. Then I got all these letters in the mail, and when I heard that, my mouth dropped to the floor. Because let me explain something. Blue Cross Blue Shield of Texas is the largest insurance company here in the state. When you have that Blue Cross card and you show up at a doctor's office, you get treated right, you get seen. You know, it's like a gold membership basically around here. You pretty much can go anywhere. I haven't really came across anybody who doesn't take Blue Cross Blue Shield. There's some cases out there, but no problem getting to access to a doctor or hospital. Basically, pretty much everybody Blue Cross. They announcing that their networks are changing. They're changing networks. And one of my letters I got, I don't know if it's this one. It might not be this one. That PPO doctors may not be taking the HMO 2016. I said, oh no, I know what's fixing to happen. And in my vision, my thought came true. Only one doctor, that whole bunch of doctors I see is in network. None of them are, other than that, none of them are taking the HMO. Not my primary care doctor, which that's really pissed me off. My primary care doctor is not in network at any insurance company that does the exchange. None of it. So I'm really ticked off at him for doing that. Even though everything's okay in 2015, I don't know why they won't do it in 2016. Let me pull up my spreadsheet because I did a thing from insurance to insurance company. The only doctor who's in the Blue Cross network is my GI doctor for 2016. Not my urologist, not my dermatologist, which the urologist, I really do like him. I really do like him, who did my kidney stone and removed it. Who else? My ophthalmologist, who I see for an eye specialist because I wear glasses. He's not in network. I really do like him too, which that's not a big deal about that. That's not really complicated medical case going to another doctor. Who else? Let me pull it up again. My orthopedic. Oh, that's right. My orthopedic is not in Blue Cross network going to 2016. As well as my reconstructive surgeon that I'm seeing next week to get my thighs taken care of. And because I heard about this back in July about Blue Cross doing all these transferring to HMO, but if I have known that their providers are going to be so limited, I would have got this done a long time ago. So sitting here on my butt. So I made an appointment to get him on Thursday. I have to get the ball rolling on that. I have to get that done this year. I don't know what I'm going to do next year. And you have to select a primary care doctor. Well, hell, if your doctor's not in network next year, how are you supposed to choose a primary care doctor? And the letter says, this is the thing I got. That you have to choose a primary care doctor and all this junk. If anyone who has an HMO, please let me know if you like it. If you don't like it, what's the turnaround time to get referred to a specialist? Because I had called Blue Cross and asked them this specific question. If you go to the emergency room and you're discharged to go see a specialist, like for instance, my hand, I was told, you have to go to a hand specialist after after you get discharged here. Does that mean you have to go back to your primary care doctor after the emergency room visit to pay that copay to see that primary care doctor, then get referred to a specialist to pay another copay? And they told me yes. The only circumstance that you don't have to see a referral to see a specialist if you get admitted to a hospital or emergency room situations. Like if you see the specialist inside the emergency room, that's the way I understood it. I said, well, that's not really a wise time to spend. I mean, why would I want to waste my time with the primary care doctor when I get told from an emergency room doctor that I have to go see a specialist? I mean, they had to wait on the paperwork to get approved by that. It's not really a good way to do that to me. I mean, it's just amount of wasted time and money, actually. Also, what has really ticked me off, Baylor healthcare system is dropping Blue Cross. Or Blue Cross is dropping Baylor healthcare system. Scott and White Baylor, and that is the largest healthcare system here in Texas, not for profit. Because I have gone to them in the past when I had a larger deductible, and they gave me financial assistance. They wrote off my medical bill, what my insurance company hasn't paid. I have gone there times that I couldn't afford my $50 copay, and they waived it. Even though at the hospital people don't know nothing about the financial assistance, but the business office took care of it. I'm gonna do a video about that. But the bad problem with Baylor is you're going to wait in the waiting room for a long time, versus here in my town, Presbyterian Hospital System, you don't have to wait so long. Matter of fact, the freestanding emergency room, I never waited in the waiting room. Or maybe in one time, maybe 5 minutes, just to sit down and go back up. Other than that, I never had to wait in the waiting room in the freestanding emergency room. Now you may wait a little bit in the exam room to get when they get all the paperwork done and all that junk, but in the waiting room, never less than 5 minutes that particular time. And actually, it was when I had pneumonia when I went up there. The front desk went to go get the nurse or whoever takes you back there, and I got right back up. Cigna, I may consider Cigna. 2 out of the whole bunch of doctors in Cincinnati, they're in network, but they're PPO at least. It's a $150 deductible and $1,000 coinsurance. And also, you just pay your 5%. Aetna's zero deductible and $2,000 out of pocket, and it's 10%. But Baylor and Presbyterian both are not in network either with Aetna. So is Blue Cross. I don't know why these big hospital systems are not doing this in 2016. This year and last year, all in network. I don't know what's going on. If these hospital systems are already opting out this fast of all these insurance companies' networks, I can't imagine what's fixing to happen in the next within the next 5 years. I just cannot imagine. Because Blue Cross said this PPO thing is affecting over 400,000 people here in Texas. So, well, what does that mean? If they opt in out of all these hospital systems, where are you going to go for medical care? Emergency room medical care. I'm not. I'd be damned. I am not going to go to some third-rate hospital. I'm not. There's one 3 miles down the about. No, I take that about 4 or 5 in Rowlett, Lake Point Medical Center. I went and take my cat there for medical care. That's how bad it is. So, folks, do your homework and make sure your doctor's, even though you had the same policy going year to year unchanged, you better make sure your doctor's in network because it will change. A lot of them opting out, which I don't get why these doctors and hospitals are opting out of these exchange plans. They pay exactly the same regardless. If patient A is the regular health plan from Cigna and patient B is the exchange plan from Cigna, they pay exactly the same to the provider. They really do. Um, so I don't know why they opted out, unless they really don't. Like I've been to, on the news. They say they get paid regardless. The network, um, in Blue Cross, I did like them. They didn't divvy up all these networks with Aetna and Cigna. They have all these different networks and all this junk. The only 2 or 3 different networks Blue Cross had is PPO, HMO, and uh, TRICARE or state employees or something like that. I think the days of good insurance, they're gone. The days of getting unlimited access to doctors, they're gone. And folks, you better watch out. We're fixing to get screwed big time. Well, I'm fixing to get screwed big time here in Texas. I mean, I don't know what to do. I mean, oh, I did. They also on the exchange on healthcare.gov. You can type in your zip code. It tells you what plans are available in your income before you go through all that sign up crap. They do have well, it's not new. New in my area, but not new to the state. Baylor Scott and White Healthcare Insurance is the HMO provider out in West Texas. And last year, they was only in Dallas County, but now they expanded to my county, which is the next one over to Rockwall, which they're the same people who own Baylor Healthcare System, ironically. This year, they came out with a PPO, and I kind of like the PPO. Baylor's a network with that on that, but I think only one doctor is in network. I think it was my urologist is in network. So either way, any health care plan I choose, I have to switch doctors, regardless of the plan. And I think it had a $100 deductible and a $700 to pocket. Which, folks, I could tell you how you can eat you out of pocket up fast. Let me show you right quick. You ever get your prescription from the doctor and they give you, like, for instance, mine is a Dexlint from a GI doctor. It's a heartburn medicine. Well, the doctors had these prescription coupons from the manufacturer in little cards. Also, you can get them from the website, like I did with my gout medicine, Uloric. Get these little coupon things. This one says 0 copay. And on here is the maximum benefit of $300. But Blue Cross, this year what I did is, like, for instance, Blue Cross's copay for Declent for 90 days supply is $175. Well, it ate it up. I didn't have to pay that $175. The coupon did. I did that on my gout medicine. I did that on my NASCAR medicine. And the I don't know if I did or not for the NASCAR. I can't remember. I did that for the heartburn, the gout medicine, and the skin medicine I took for the dermatologist. I'm about to do a video about that too. But in reality, this year, I only paid $40 or $50 for out of pocket. And after that, my healthcare plan paid 100% for everything. No more. I don't have any more copays for prescriptions or medical care. Because under Obamacare, your prescription copay go towards your out-of-pocket maximum. Well, I don't have a deductible on my plan this year, and just $500 out of pocket for Blue Cross. So the insurance company doesn't care if you have a coupon for a prescription. Now they won't do that if you have a mail order. The mail order people, they don't process that, so you have to go through the retail part. Or if you do go through the mail order, you do have to pay for it, but you can ask them for a reimbursement form from the coupon people um, to do that. But I like it, the instant savings right there at the counter. So I think at the counter I only pay $40 or $50 for my medications. Um, yeah, I can't remember if I did the NASCAR because that came in the mail from the NASCAR people. So I had to been the Dexlant, the Loric Taxalone, which is a skin that dermatologist gave me for my rashes on my thighs. Some other medication I can't remember that I had all these coupons and ate it up. The same thing last year. I did that with my gout medicine, and I did pay for some office visits for my physical therapy. But time came around towards the end of the year for my shoulder surgery. Blue Cross paid 100%. I had no more copays after that, and that also messed. That claim got fit. The hospital claim itself for the surgery was okay. It was just the one for my MRI was kind of messed up, and I had to file a complaint with the Department of Insurance. Even though they said, "Hey, we're gonna fix it," but it, I was afraid. The time I got to the hospital, they want their $200 because that's the same hospital system I went for my MRI. And I'm like, I don't owe that $200. The thing online says I have met my out of pocket. No more copays applied. Um, so that's how you can also get around with the out of pocket. Because old days prior to Obamacare, your prescription copays did not go towards your out of pocket. Only your office copays did, and your deductible. Did the deductible? Okay, no, the deductible was separate. Then you had your out of pocket. The copays went towards your out of pocket. But now under Obamacare, your deductible also go towards your out of pocket. But folks, that's probably why Blue Cross is going broke because of this as well. But I'm telling you, folks, we're getting screwed big time. Because I have heard this happening to other states, like I said. Especially, a lot of people have problems out in New York finding medical care. No one would take the exchange plans at all. No hospitals, no doctors, or nothing. And in my opinion, Obamacare has wrecked a lot of things. They have screwed up people's lives because of this. People have to sit down for hours and hours on end to figure out, to make sure you sign up for the right plan. And folks, read your summary of benefits before you select a plan, because like on healthcare.gov, there's a little thing that says summary of benefits. Don't trust what that healthcare.gov says, because I've seen it wrong. Last year things were wrong on it. Click on that summary of benefits. That will, I'm going to do a video about this too. That will tell you the correct plan information, like what your copays are, what your deductibles, and all that, what's covered and what's not covered. It's just some of your benefits. Read that. Don't rely on that healthcare.gov site, because last year I was reading the plans, and I think United was on there last year for 2015, but they're not this year in my county. But I checked Dallas County. It's funny, if I move across the lake, it'd be Dallas County, because I live in the smallest county in the state. We used to be considered in the 1900s Collin County, but we just made it a little square, made our own county. um, this used to be so rural over here, but it's not anymore. The last 20 years. But I'm telling you, folks, we're fixing to get screwed if we're not already. Because and then you cannot buy insurance directly from the insurance company unless it's open enrollment. If you do that without going through healthcare.gov, you still will have like a $6,000 deductible, $10,000 out of pocket. I mean, it's really not worth having insurance at that point. unless you never get sick and never need medical attention unless you go to the doctor once a year. That's the only case I could think of. But I think this is a big disaster. I think this should have never have been like this. The only thing I do like about the Affordable Care Act is the thing that no one gets turned away for no pre-existing condition. Because in the old days, without having a group plan, I would have been to die like that due to my weight, big time. And in the old days, you could buy insurance at any time you wanted to. But now, hell no. You have to have a special qualifying event. Um, and what they should have done is the federal government should have went ahead and let the states do their exchanges. Now, of course, Texas said, no, we're not going to do one. But then they also should have done is let the insurance companies do the subsidies itself instead of getting the third thing, third party involved like healthcare.gov. Let the insurance company could have done that, because let me tell you, insurance companies do know how to manage money. They sure do. When it comes to their own money, they can manage it good. Now they might screw you over once, if you don't pay your premium, but they can manage money better than the government can. I can guarantee you that. And some states, to my understanding, they just opened up Medicaid and people dumped onto that. Here in Texas, they didn't do that at all. Here in Texas, you pretty much have to have kids to be on Medicare or pregnant, and a woman. Pretty much, if you're a male, you can't get on Medicaid at all, unless you have a bunch of kids. Only thing I can figure out, because I applied for one once and was denied because I had no kids. No wonder people have kids. That's probably number one reason you get all these benefits. Because there's been times in the past when my employer has reduced work hours big time, but I think they kind of skirted some laws there, because under the law it says, to my understanding, if your employer offers health insurance at a full-time position, and if you go towards a little part-time, that means that you are covered by COBRA. I guess my employer was nice enough not to do that, is because at COBRA you have to pay the full price of health insurance premium. I don't know, folks. This Obamacare is just a disaster, big time. They just need to get rid of it. And the only reason why one part of the reason why it's so damn high is policies covering crap that's not even necessary. I don't even know I have my policy book in here. For instance, my policy, pretty much all of the healthcare.gov policy, covers pediatric vision, contraceptives, birth control. Oh. That's another thing I'm mad about. That makes absolutely no sense. And what healthcare should really be is a la carte. For instance, if you want coverage for weight loss surgery, fine, you pay $5 or $10 extra for that. If you want vision, fine, pay for that. Or if you want coverage for rehab for drug problems, pay for that. But don't make the whole entire group pay or the whole gamut pay. Oh, another thing that pisses me off about healthcare.gov, I should not have to pay if for instance, we were on a group plan. I should have to pay for adult co-workers, adult children to be on the plan until the age of 26. If the Affordable Care Act states that no one can be denied health care for pre-existing conditions, why do adult children have to be on the policy till the age of 26? That makes no sense. And I shouldn't have to pay for that. Now I see what they could have done. They should say, well, fine, until the age of 18, where people get that fall in the gap. Fine, let's just make it to the age of 20. Make that a year or two gap okay for them. Fine, to the age of 20. That's a good point. Cutoff date. when teenagers get to that cutoff point, that's how they get screwy. Make it to the age of 20. Why? But wait until the age of 26. I'm really surprised insurance companies didn't fight that tooth and nail. Well, this is just too long of a video. I'm going to make a point, make another video sometime, but I'm through today. If you have any questions, comments, please post below. If you do have an HMO policy, please let me know if you like it. If you don't like it, stay away from it. Just let me know.